A lot of patients that come to see us are very concerned with the mercury-containing amalgam metal fillings that they have in their mouths. And there's a lot of debate currently out there regarding the safety versus efficacy of these filling types. But one thing that's for sure is the neurotoxin capability of mercury. And obviously, the more fillings you have in your mouth, the more you're being exposed to. And some people's immune systems are healthy enough to deal with that, and others aren't. Just as with any other type of chemical, people are going to have different sensitivities to things. So we definitely want to be receptive to patients that come here wanting these restorations evaluated or removed. And we do a lot of those type restoration removals and replacing those with metal-free bonded resin fillings, or having to cover a tooth with a metal-free all-ceramic crown. But just want to kind of walk through the process to what to expect if you are looking at having one of those fillings removed. Which first thing we do is you'll always be on a vitamin C regimen starting 3 days prior to that amalgam removal. We use a lipospheric form of vitamin C, and what that does is it increases the antioxidant load in your bloodstream that is capable of binding to any mercury that is in your bloodstream and help escort that out of your system. First thing we're going to do after you're comfortable and that tooth is anesthetized is to isolate it with a rubber dam, which is a latex type sheet that essentially stretches over your teeth that really separates everything that we're doing from your mouth and keeps the saliva and contaminants in your mouth out of what we're doing as far as allowing us to get a stable quality bond to the tooth. After the rubber dam's placed, the patient's covered with a disposable drape to prevent any mercury particles from getting into their clothing or their hair or their eyes. We'll cover their hair and their eyes with protective glasses or a mask, and we would do that for any procedure. It's no different in the amalgam removal. We're also going to have an alternate source of air, whether they're just breathing on oxygen or whether they're breathing nitrous oxide, laughing gas, and oxygen. Either way, we're going to have something on their nose to allow them to breathe. That way they're not breathing in through their mouth while we're removing that mercury-containing filling. We're also going to place a dental air vac within 8 inches of the patient's mouth just while we're removing that mercury filling, that's going to pull off any excess mercury vapor that's released as we cut through that filling that we're removing. We're also placing a saliva ejector underneath the rubber dam to help with any saliva that's collecting while they're having to keep their mouth open and help deal with any particulate that would get underneath that dam. We're going to be using high volume suction and copious irrigation with water outside of the rubber dam as we're removing that filling to try and remove all that we're cutting out into that suction. And we've also got a centralized mercury separating unit attached to our office water system that's preventing that mercury from being released back out into the wastewater system and going into the municipal water source. We've got 5 HEPA filters here in the office that are completely filtering out all office air, not just in the operatories, but even in the waiting room. And it's the best quality air that you could breathe. Once the procedure's done and the new restoration's placed, we provide the patient with 2 capsules of activated charcoal just to help bind up any elemental mercury that would be in the gut system and help bind that and escort that out. And then beyond that, if there's any interest the patient has in any detoxifying or immune system supplements, we can discuss that with them to help aid them in their recovery, because it's not an immediate process. It takes a long time for the body to be able to continually shed itself of all that mercury that it has stored up over the in some case, decades that these patients have had those restorations in their mouth.